Question number 8. Order. Question number 8, Kevin Hague.
Point of order, Mr. Speaker.
Point of order, Kevin Hague.
Mr. Speaker, I direct your attention to Speaker's ruling 168, in particular 4, but all of the rulings on that page are relevant. Mr. Speaker, my question relates to the use of Section 32 of the Public Health and Disability Act, and I seek your guidance as to whether the fact that this question has been transferred from the Minister of Health to the Associate Minister of Health means that you have accepted that the Associate Minister of Health can be delegated the power that is set out in Section 32, as that has not been the historical understanding.
Good. I appreciate the member also raised this point through an email earlier in the day, and that is exactly right. I have been assured by the government that a minister to whom the delegation has been referred to does have the ability to direct under Section 32. So I want to refer the member to 2 Speaker's rulings which I think are critical to this. Speaker's ruling 1671, that a question must be addressed by the minister primarily responsible, and even of stronger value I think is 1675. Ministers not only have a right to determine which of them is the appropriate minister to answer, but that they have a duty to the House to decide on the most appropriate minister to answer. I've looked at the delegations. There is no doubt that this matter has been delegated to the Associate Minister. On the advice that I've been given and an assurance from government, in the event that a directive was required, the Associate Minister has the ability, the legal authority to do so. There is no doubt that I think this question has been responsibly transferred for the member to get the best chance of an answer. Question number 8, Kevin Hague.
Thank you, Mr. Speaker. My question is to the Associate Minister of Health and asks, will he now use his power under Section 32 of the Public Health and Disability Act 2000 to direct Capital and Coast District Health Board to initiate the transitional support plan for Ashley Peacock, which recommends a pathway to a community placement immediately? And if not, why not?
The Honourable Peseta.
Mr. Speaker, that member should know that what he has asked for is illegal and would breach both the Public Health and Disability Act 2000 and the Crown Entities Act of 2004. The legal advice that I have received confirms that as Minister, I cannot issue directions to district health boards requiring or compelling them to provide specific treatment to specified persons.
Supplementary.
Supplementary question, Kevin Hague.
Does the Minister accept the findings of the National Intellectual Disability Care Agency, who found that Ashley's seclusion environment is exacerbating his condition? And if so, why has he allowed Capital and Coast DHB to sit on the recommendations for his transition plan for months without even appointing a project manager for Ashley's case?
The Honourable
Mr. Speaker, like many New Zealanders, I have sympathy for the parents of Mr. Peacock. However, what I am informed, sir, that the District Health Board and the Ministry of Health are working alongside the family to provide for a transition plan for Mr. Peacock to be placed into the community.
Supplementary.
Supplementary question, Kevin Hague.
How does the Minister reconcile his government's treatment of Ashley Peacock and his answers today with New Zealand's last periodic report on the United Nations Convention Against Torture, which identified the irreversible psychological harms of long-term seclusion, such as Ashley has endured?
The Honourable Peseta Sam Lotu-Iiga.
Mr. Speaker, what I say to that member is that this case is complex. Mr. Ashley clearly has a mental illness and he also has developmental disabilities. But what is paramount in this case is the safety of both Mr. Peacock and those around him. And the transition plan that has been formulated by the parties that I referred to in the earlier answer is paramount that the safety of Mr Peacock is at the front of all these considerations.
Supplementary, Mr Speaker.
Supplementary question, Kevin Hague.
Given that Ashley has been predominantly held in effectively solitary confinement for more than 5 years now, why is the Associate Minister ignoring the Human Rights Commission, the Ombudsman, and now the National Intellectual Disability Care Agency, who have all recommended his transition out of seclusion without delay?
Mr Speaker,
The Honourable Peseta.
Mr Speaker, I said in the first answer that member was wrong, and I'll say in this answer he is again wrong. He has not been held in solitary seclusion for that period of time. In 2014, for example, he was held in seclusion for 68 hours. That's 1.5 hours on average per week.
Point of order, Kevin Hague.
Mr Speaker, in his answer to the primary question, the Minister indicated that he had received legal advice and I asked that he table that advice.
Well, I'm not sure the member can. If he was quoting, the member can certainly ask whether the Minister was quoting from a legal document at the time he gave an answer. Was the Minister doing that?
Sorry.
Was the Minister quoting from a legal document as he gave his answer? He was not.
Quoting legal advice.
Oh, that sort of legal opinion. All right.
Supplementary question, Poto.
Why did he say, and I quote, "I've been given reassurances that the Health Board are working closely with the family on a solution," end quote, when sources close to the family claim they have been excluded from meetings with Capital and Coast DHB management and senior officials?
The Honourable Peseta.
Well, Mr Speaker, again, that member is wrong. The advice that I've been given is that they are working closely alongside the family for a transition plan for this individual, and it's sad, it's very sad, Mr Speaker,
Order.
that members opposite are using this case as a political football to advance their political interests.
Question number 9.